Comfort. Okay, so what are, in addition to what you've mentioned already, can you take us through a little bit of the attributes of bipolar disorder in terms of what people who have it typically present with?
Yeah, and from an integrative practitioner standpoint, I think we end up seeing people who are the undiagnosed bipolars sometimes too. They just they're moody or they're angry or they're irritable, and they come in with fairly nonchalant symptoms. Some of the symptoms that we should be paying attention to are fatigue. I can't get out of bed, and we start thinking in more of an energetic standpoint, and sometimes it really is an underlying psychological condition. Other things are insomnia. Insomnia is natural medicine practitioners, we have a myriad of things that we can help with sleep, but maybe it's something else that's underlying it. So sleep and fatigue are two of them. Another one, if you kind of look in their history, is asking questions about how do you cope with stress. And I actually do it kind of like an interview. Instead of just saying, do you react well to stress? I say, tell me about 3 different situations in which you would react, or what would happen if this were to stress you out. And then broken relationships is kind of unfortunately a paramount thing in a lot of bipolar conditions.
So, and when just going back to the stress, because that's an interesting and I think a really wonderful way to interview somebody about stress is to give them scenarios and ask how they would respond. What would you expect to hear in somebody who has bipolar disorder?
You hear very emotive terms when they're describing this. They'll say things like they'll lose it, or they'll blow a gasket, or they just can't handle it. And those key phrases resonate with me as a clinician, saying, I think I know them.
Okay.
There are more validated and secure ways of doing it. There is a mood disorder questionnaire that I use as well.
Okay. All right, good. Okay, so